know. That's what I'm like. Healthcare. You want to talk about being a free healthcare and the socialist healthcare here in Canada? It sucks, man. It's brutal.
It's terrible. It's
You know
terrible.
what it's great for? It's great for one thing. It's great for like, my kid gets in a, riding his bike, falls and breaks his leg. I can get that taken care of. It's covered as far as that. Or we get in a car accident and like that's fixed. The emergency stuff.
Yeah.
But like right now, I'm trying to get my knee done. You know, I first of all have to get a referral from my family doctor, assuming I have one, which I do, thankfully. But
Yeah.
go get a referral from this person. I have to book an appointment, wait a couple weeks to get in with them, get a referral, then send a referral to a surgeon. That takes like everywhere I've been talking, like but some of the early places without a hookup, it's like November, right?
Yeah.
So I gotta wait 2 months to get that, and then I gotta get a book the surgery booked if I need that. It's gonna take another probably 3 4 months. So by the time I get after this knee, it's gonna be about 7 8 months almost,
It's gonna cost you money, right? That's
right?
money.
Yeah, exactly.
And
Like,
whereas you probably are heading down the line where you're like, well, how much does it cost? I'm willing to pay for it.
yeah, man, that's what I mean. It's like I went after my fight, I broke my nose, and Bellator pays for anything 30 days after that happens in the fight, right? So I was
Yeah.
like, I'm just gonna get this fixed here. Like, just get reset anyway. So we went down. I walked in the hospital. They're like, yeah, we set an appointment with an ENT the next day. So I was like, perfect. Go to the ENT. She's like, okay. She looked at it. She's like, okay, I'm gonna put you in surgery tomorrow. So in 3 days, I got all
Yeah.
that taken care of. Where here I'd be waiting months.
Months. Yeah. And your nose would be stuck fucking shifted
Yeah.
outside.
So like
I
I know there's again there's cons to the private healthcare too. I get that. There's
yeah.
no utopia. Everything's perfect. I get it. But as far as what we're paying into this, it's not. You're not getting it back. I
No.
feel it's not worth it.
No, and I'll give another example. And this is where my eyes opened to the healthcare problem. Was when my wife was pregnant with our second. She was at work, and she slipped. She didn't fall, but her like leg slid from under because she's a hairstylist. So she like stepped on a piece of hair, and it kind of slid. And then she
Mm.
got a huge pains in her stomach and in her like her uterus area. So she calls me. She's like, "Dude, it's like fucking killing me." And I'm like, "Okay." So we have my daughter. She's only 2. I fucking bundle her up. It's like cold. It's like November. We go to the hospital and we're sitting there for about between 6 to 7 hours in the emergency,
Yeah.
waiting for a doctor just to see her. It ended up she was fine, right? It was just like she stretched something. It was just a little bit of pain. She was fine. But what are the what if she wasn't?
Yeah.
Right? What if she wasn't? And I was sitting there for 6 7 hours about to lose my son, right?
Yeah.
And I even went up to the nurse. I'm like, I'll pay a doctor to see her. Like
Right.
I will pay you $500 just to come and tell me, she's okay,
Yeah.
right?
Peace of
But
mind.
right, but no, you can't do that. Want more podcasts? Head over to gmg-podcast.com.